Now, from the News Channel 5 network, this is Medical Mondays.
Well, good evening, everyone. Welcome to News Channel 5 Plus. I'm Casey Mason. Thank you so much for joining us here for our Medical Mondays. And tonight we're talking about a topic that a lot of folks can relate to, chronic pain, specifically when it comes to your back. And joining us this evening, we have Dr. Satish Reddy joining us. Doctor, thank you for joining us this evening.
Thanks for having me, Casey.
We have a lot to cover tonight. First of all, you are with the Pain Management Group, right?
Yes, ma'am.
Wonderful. I would like to kind of kick off the show tonight to talk a little bit about, your expertise and the correlation we'll be learning about. You are an anesthesiologist,
yes,
and how that really relates to back pain.
Okay. So, anesthesiologists typically can train an extra year in a fellowship to become board certified pain management specialist. The reason that anesthesiology kind of branches off into pain management is really because we do a lot of the same procedures. So people get epidurals for labor, which we do a lot for anesthesiology, but you can actually specialize that a little bit more and do epidurals in a lot of different places in the spine. So that's why pain management steps in, and there's a little extra training for that. We also use a lot of the same medications for treating pain acutely after surgery, and that branches off into chronic pain and how we use those medications for much longer periods. So there's a little bit of correlation, but it does take a little extra training afterwards.
Definitely. It kind of gives folks a background on, your story and a little bit about how that's going to relate to tonight's topic. And again, I mean, don't you agree this is something that I think a lot of folks tuning into tonight will have questions, maybe even some stories you want to share with us. And of course, this is free medical advice with the expert here himself. So I do want to go ahead and give you that number as we're kicking off tonight's show. The number there, it should be on your screen. I'll go ahead and give it to you here. It's 615-737-7587. Feel free to call in. We would be so happy to hear from you this evening. All right, well, doctor, let's just go ahead and dive into the topic tonight. Give us, an overview of exactly what is back pain, chronic pain, and just some facts about it.
Okay. So back pain typically is what people think about for low back pain or any type of pain that hurts in the back and runs down the legs, but you can actually have back pain in the mid-back or in the neck as well. And in the neck, you typically have symptoms that run into the arms, and in the mid-back, you'd have symptoms that can run into the chest wall, kind of wrapping around you. So most people typically have low back pain, but a lot of patients that we see have the other two as well. Back pain itself is probably one of the most common complaints in medicine today. I think 76 million people have pain acutely that bothers them for more than 24 hours. So that's 1 in 4 Americans. And pain in general is the #1 cause for anyone to access the medical system at all. So it's a very prevalent problem, and we see a lot of patients who need our help, so it's great.
Dr. Reddy, before the show tonight, we were just chit-chatting about tonight's topic, and, we were talking really about how your back, I mean, it affects everything. If you have back pain, you have all over pain.
Yeah, absolutely. The back's job is to protect the spinal cord and give us support, and once things start sliding off or, pinching those nerves, you can definitely have pain almost anywhere, so.
Exactly. And, diving into the Pain Management Group tonight, I do want to talk about, your practice. And we were also speaking tonight about when dealing with treatments, there is a bigger issue that does occur, and that is with, addiction.
Absolutely. So when a lot of people think about what is a pain clinic or why do you go to a pain clinic, people assume that it's, mostly for opioids, but there's actually a lot more that we do. And really we like to think of opioids as kind of the small portion of what we do to fill in the gap for all the other treatments that we use. So, I think what sets us apart at the Pain Management Group, and it's really one of the reasons that I decided to come to this practice specifically, is that we really have tools to treat an entire patient. So, I always tell patients there's kind of like a toolbox that we have, and it's physical therapy is one of the tools, medication's one of the tools, and when it comes to medications, there's opioid medications, which is what people commonly think about, but there's also a lot of other medications that we call adjuvant medications, so muscle relaxers, medications to calm the nerves down if they're pinched or irritated, anti-inflammatories. I mean, there's a lot of different medications that aren't just opioids that we like to consider. And then there's intervention, so a lot of us are interventional pain management doctors, so we do procedures on the spine or in other places as well. So that's a large portion of what we do. And then think about referrals to surgeons if that's appropriate, but it's kind of a stepwise way of, escalating care as it's needed. But opioids are a minimal portion, of what we do.
Definitely, and and just in your personal, opinion and being a part of the pain management group, you really do feel like you all have set yourself aside.
Absolutely. Beyond just the physicians and the tools that we have, we also have a psychologist who we refer probably a large majority of our patients to, because it's hard to consider that someone has chronic pain every single day of their life, and they won't be affected by anxiety about it or depression from the things that they're not able to do that they used to be able to do. So we make sure that that's well taken care of. So that's one component. And then we also have a dietitian, and people are always a little bit surprised, but most pain conditions, there are dietary modifications that you can make, whether it be pro-inflammatory conditions where you would go and talk to ways to reduce inflammation in the body, but everything can be modified with diet to some extent.
I did not know that. Tonight,
Yeah,
that's something
absolutely.
I'm learning here myself. I find that very just intriguing. That's interesting.
Yeah, so she sees patients with really any kind of pain condition, as long as they also have diabetes, which is kind of one of the gateways to get into her. But then she assesses if it's weight loss that's going to help with your chronic pain, because that's extra stress on the bones, or again, if it's modifications to some of the foods that you're eating that could be making some of your pain conditions worse. She's great.
Do most places give those types of treatments? Is this something that really you can only find at the pain management group?
In Nashville, I believe we're fairly unique to have all of these things in one place. So.
I'd say so, yeah. I think that's really interesting to point out. We, again, appreciate you joining us tonight. We are going to learn a lot about tonight's topic. So moving on here, just a few talking points I wanted to cover. We kind of went over the overview of back pain from Dr. Reddy tonight, but let's talk about some of those causes. What causes this type of pain?
So when you break the back down, fundamentally, there's a few things that can actually cause the pain. So people will always say, I have back pain, but the first question we as a doctor would have was, what's causing the back pain? So there's discs that can be causing pain, and then a lot of people will think about a disc bulge. So if a disc bulges back, it can compress some of the nerves or the spinal cord. So that's what causes, people always talk about sciatica and pain that runs down the legs. So that's commonly what would cause that. You can also have arthritis, and arthritis can cause pain when you extend your back backwards. Some of the bones will start contacting each other, and that can cause pain. The arthritis can also cause some bony overgrowth, which will also pinch the nerves in the spinal cord. So those are two ways. Those are kind of the two fundamental ways that we think about it, but there's obviously a few more things in the back that can be causing the pain, but those would be the two main ones.
The causes, they can vary, really a broad spectrum for reasonings. I see here, there are two types of injury in the spine. Can you tell us what those are?
So that would kind of be the two causes of back pain, would be either a disc-related pain or talking more about the arthritic type pain. People can have kind of wear and tear that builds up over time, and that's probably the most common thing that we see is arthritis that's just, living a hard life, working hard, and it's just built up over time, and you start seeing those patients later in life. Another type of injury to the spine would be something more acute, either a whiplash injury or falling, things like that, and that can cause an acute disc bulge. So that's probably where those two things fundamentally differ a bit.
All right, well, doctor, we're going to take a quick break, and we will be right back.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. I'm often asked, how do you get those big settlements? We won't stop till we get to the top on the negotiation. That's how you get the big settlements. I'm Kevin Kennedy with the Kennedy Law Firm. Call us today.
This week on Fishing Affliction TV.
I ain't going now, big doggy. Oh, nice fish, big dog. Nice fish.
Join Team Fishing Affliction for some fishing action on legendary Lake Okeechobee for day 2 of Fishing the Big O.
All right. right. Boy, it didn't take long, did it?
No.
Your Fish and Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fish and Affliction time for those who got it bad.
This is my new best friend, Esther. She might look like any normal, playful puppy, but Esther's being raised to become a Canine Companions for Independence assistance dog for a person with a disability. To get there, she needs lots of loving care and attention, plenty of exercise, and good eating habits so that she can live a long and healthy life for her future family. Visit cci.org or call 1-800-572-BARK. Raise a puppy, change a life. You can make a world of difference in the life of a person with a disability.
If you don't fix them, sparks from dragging tow chains could cause a wildfire, and that could be scary. Smokey. Only you can prevent wildfires.
Your daughter is having trouble learning French. Do you A, hire a tutor?
Bonjour.
B, enforce a French-only rule at home? Or C, watch some foreign films? When it comes to parenting, there are no perfect answers, but that's okay, because you don't have to be perfect to be a perfect parent. Teens in foster care will love you just the same.
Did you take your medicine?
Oh, gosh, I forgot it.
Her nurse.
You need a claim number?
Her personal assistant.
Let me just grab a...
Her housekeeper. Her cook. Her accountant. When I started taking care of Mom, I didn't realize the challenge of playing so many roles. But above all, I'm still her daughter.
Visit aarp.org/caregiving to connect with experts and other caregivers. Together we can better care for ourselves and the ones we love.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. You know, Benjamin Franklin once said, the early bird gets the worm. Now, if you've been injured in a car wreck, don't wait. The insurance company won't wait. Call us now. That's 931-645-9900.
Welcome back to Medical Monday here on News Channel 5 Plus. I'm Casey Mason, joined tonight with Dr. Reddy, and we're talking about something that I think a lot of folks have either dealt with or know someone who has, and that's chronic pain. Doctor, thanks for joining us.
Yeah, thanks for having me.
You know, the first part of the show, we went ahead and kind of talked a little bit about an overview of what back pain is, and just some facts about it, maybe even some causes. And in this segment, we're going to go ahead and kind of talk about, ways you can deal with pain. But first, we do have some callers on our line we want to get to. First, I'm going to take our call from Tony, and Tony's going to tell us a little bit about maybe some questions he has for you tonight, Doctor. Tony, good evening.
Yes, ma'am.
Thanks for joining us. We have you live here on News Channel 5 Plus for Medical Monday. And what would you like to share with us this evening?
Yes, I would like to ask. I'm 61 years old. I have deteriorated disc disease and back problem and a cervical spine in my neck. And I'm wondering what kind of alternatives is there that I can get over the counter medications that can reverse this rather than have to take narcotics. And also if there's an alternative for foods or what type of exercise I could do.
Great question, and we really do appreciate you calling in tonight, Tony. Doctor, I'll let you take this.
Tony, thanks for calling in. So to answer the first question, are there alternatives to treatment? One of the first things that we'd have to do is kind of correlate your symptoms with what your imaging looks like to really determine exactly what we would do. But there are some options other than surgery and opioid pain medications. There's things like epidurals that we can do up in the neck where we would put some steroids and some local anesthetic in to reduce the inflammation on some of the nerves. There's also something called radiofrequency ablation that we can do to remove some of the sensation from the joints where you have arthritis to reduce the pain strictly in the neck itself. And then in terms of medications other than opioid medications, there's muscle relaxers, there's medications to, again, calm the nerves that may be pinched that can cause pain into the arms. There's anti-inflammatory medications, but there's a lot more than opioids, and imaging would kind of guide us into what kind of treatment plan. In terms of exercises, again, it kind of depends on exactly what the imaging looks like. You'd want to make sure that there's no instability in the spine before we do some of the exercises, but physical therapy is one of the most important things that you can do for any type of chronic pain. It probably has the most long-term benefit for anything, and what physical therapy is really doing is it's stabilizing the spine, so it may not actually reverse what's already there, but you're going to stabilize the spine so the pain doesn't bother you as often, and you can hopefully prevent it from kind of getting worse over time as much as possible.
Lots of great information there, Dr. Reddy. Again, we appreciate your calls this evening. We do have another caller. We'll go ahead and take him here, I think, on line 1. Do we have Joe on line 1 with us tonight? All right, we'll check maybe line... Joe, are you on line 1 here for us?
I believe there's somebody else on the line. You just got to talking to me.
Okay, all right. We'll figure that out after our next break. We'll get to those calls tonight. We'll get that figured out there. But, you know, we definitely want to hear from you this evening. And, you know, again, this is free medical advice from an expert. Doesn't get any better than this. So we really are learning a lot tonight. I know myself, I am about, you know, different issues dealing with chronic pain, especially relating to your back. And let's go ahead and kind of talk about that next topic I had for us. And that was, we went into the background of what exactly is back pain, how does it occur, but now the most important thing, how can we take care of this issue? And I do want to note that the Pain Management Group, you know, you all are the longest pain management practice here in the state. That's for 25 years. Obviously something to be very proud of.
Yeah, we've been here for quite some time, and things have changed over the time, but we've stuck around. Hopefully that means we're doing things the right way.
I'd say so. Well, Dr. Reddy, let's go ahead and just discuss this. You know, what are some options, some ways we can help treat this issue?
Absolutely. So, again, one of the first things that we do is start with imaging of the spine to really distinguish what the problem is. So step 1 is always figuring out what portion of the spine itself is causing the pain, and then figuring out where we can go. So, you know, when I think about treating pain in general, it's kind of doing the least invasive thing possible first, and then escalating from there as we need to. So one of the first things that we do is get the imaging and then send you to physical therapy, as long as that's safe to do so. And then really kind of basic medications or anti-inflammatories, some of which you can get over the counter, but there's some prescription ones that may work a little bit better that we can start in clinic. And then for patients that have muscle spasms, which are fairly common, there's a lot of great muscle relaxants, and patients are a lot of times concerned about sedation from those medications, so we're always pretty careful about that. And again, for patients that have pain that goes down the arms and from an irritated nerves, there's multiple medications that can be used for that. The most common one that people kind of hear about is gabapentin or Neurontin, and that's something that's quite commonly taken. That actually can help almost any type of chronic pain syndrome these days. So those are kind of the first things that we do, and those are things that you'd probably notice on a first visit when you come to see us. And then from there, you know, we fill in the gap with what else do we need. So we start considering things like interventional treatment. So is an epidural going to be more beneficial, or is the radiofrequency ablation going to be more beneficial? Is something like an injection in the actual joint in the spine going to be beneficial? And then there's even more kind of advanced therapies for patients that have had previous back surgery, or even before back surgery. Sometimes when you've failed all other treatments, there's things like spinal cord stimulators that we can consider. But again, it's kind of escalating up as you need to and not doing the most invasive thing first. And then again, to fill in the gap, there are narcotic or opioid pain medications that you can use, but you know, we try to reserve that for the gap where the other things haven't quite filled it in. And then lastly, for patients that kind of are untreated with all of those options, there's surgical referral. That's an important piece of the puzzle too.
I mean, lots of great options there. That's a pretty long list. Yes. We're going to go ahead and try to take Joe here on line 1. Joe, can you hear us?
Hello.
Hi, Joe. How are you doing tonight?
Doing without.
Well, we are happy that you called in tonight, and of course you're live right now on our Medical Monday segment talking with Dr. Reddy. What do you have for us this evening? What would you like to talk about?
I've got pain in my back. It's kind of like between my hip bones. I just lay down on the edge of my bed and with my feet on the floor and lay back, and I got that pain. I usually get it from when I'm walking, like if I try and do some shopping.
Yeah.
And the doctor has put me on a medication supposed to help my back pain. It's not working. It's Oh boy. Diclofenac.
Sure. So diclofenac's an anti-inflammatory. So again, imaging would be the first piece of the puzzle to really figure out. So just for example, in the low back, you think about how many different things can be right in really about 2 or 3 inches in the area that you're talking about in the hip, or a lot of people call it buttock pain or hip pain or low back pain, and it's really all the same area. To different people they call it different things, but there's the facet joint, which is the joint that actually connects the vertebral bodies, or the vertebrae in the spine, all the different bones that stack on top of each other. So those are joints that can have arthritis. There's the disc in the front that can also cause back pain if that's irritated or bulged backwards. But even outside of the spine in the low back, within an inch, there's the sacroiliac joint, and that's the joint that connects the back to the pelvis. And a lot of people, especially if you have another problem and you're not walking quite the way that we're designed to walk, you can have inflammation of that joint because it'll start to rub against each other. The two bones will start rubbing against each other, causing inflammation there. And then you do have the hip joint almost an inch away from that, and the hip joint itself can cause problems. And then there's a bursa on the other side of the hip joint, which can also cause problems. So a lot of times it's a physical exam that's going to lead us into what's important. The imaging is a really important piece of the puzzle that tells us which way to go. But things like you were talking about, when you bend backwards and that causes more pain, that also leads us to think a certain way. Because if patients have more pain when they extend backwards like that, typically it's those joints in the back that are collapsing into each other and causing more pain. So, the history is really important when you tell us things like that. So diclofenac is one of the pieces that we can use to help treat that, but there are a lot of other options that we'd need some imaging to kind of get to, but there's more options than that. For sure.
Yeah, Joe, Tony, thank you so much for calling in tonight. We really do appreciate that. I hope, Dr. Reddy was able to help you a little bit this evening. Again, we love to hear from you. That number on your screen, 615-737-7587. We'd love to hear from you here on The Plus. Dr. Reddy, let's you touched base on this a little bit already, but walk us through, I think a lot of folks, that scary moment of you make the appointment and you want to know what exactly can I expect when I walk in the door, and, some of the ways that this pain is actually diagnosed there in the office.
Sure. So, I guess I can walk you through a first visit with one of us and exactly what you can expect and what you'd expect at the end of the visit. So the first thing that we would go through is the paperwork that you fill out. And the paperwork's kind of a guide. It's your way to really explain exactly what you go through every day. So it's asking, where's the pain? Where does it go? How much does it bother you? What does it feel like? What have you tried before? So we're just trying to really understand the problem the best way that we can. So you'll fill that out, and we would take that in as one of the first things that we go over together. And then we would take any imaging that you have and try to correlate what your pain feels like to what the imaging looks like to figure out the problem. If you don't have anything and you're kind of coming to us as just saying, I've had this pain for a few weeks or a few months, and you haven't had any imaging or any workup, one of the first things you can expect is, again, imaging. You probably heard me say it a few times now, but that's just how important it is to figuring out exactly what we do. So we would start with an x-ray fairly conservatively, and as long as that looks stable and doesn't show any kind of instability of the spine, one of the first things that we would recommend leaving on your first or second visit is physical therapy again. So after we've kind of guided ourselves into what exactly the problem may be, that's when we start exploring some of the medication offerings. If you have muscle spasm or muscle tenderness on a first visit, and we can find out on an exam, that's something that we commonly would prescribe as a muscle relaxant. If you have pain that's kind of classically sciatica, as everyone calls it, or pain that radiates down the leg from the back, then gabapentin is something that we'd probably start with at our first visit. And then anti-inflammatories are kind of a mainstay of treatment. And then where we go from there really depends on, did you get better with the physical therapy and some of the really basic medications? And if not, then we typically will get something like an MRI or a CT scan. And that really gives us a lot of pictures of the spine, and that really gives us a lot of information in terms of what can be beneficial as the next step.
All right. Great to walk us through that. I think it's important that folks kind of, can prepare for what to expect when they do walk into that initial appointment.
Definitely.
We're going to go ahead and pause for a quick break, and we will be right back. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
It's been a soggy and therefore cooler start to the week than what we had last week. Rain helping to suppress temperatures a touch this afternoon. And we've had some very efficient downpours in some spots overnight Sunday into Monday. Some folks have seen nearly 1.5 inches, even a little more. Now, as we head into Tuesday, Wednesday, it will be a drier stretch, but not completely bone dry. We can't kick those rain chances just yet. Here's a look at temperatures across the southeast. We are not the only ones on the cooler side of things. Normal for Nashville this time of year is 90, and we're not expecting a 90-degree temperature anywhere this week. Here's a look at current conditions in Nashville. Overnight tonight will be fairly mild, and then we'll continue to see rain chances. Stubborn rain chances stick around. So a spot shower storm is possible during the evening. That'll be the same thing for Tuesday and Wednesday, with more widespread rain expected as we head towards Thursday, Friday, and Saturday.
One-handed. All right, here we go.
This is us star Justin Hartwig, stealing hearts and shooting hoops.
Mime yourself inside a box.
Very good. Then, if you're trying to lose weight, you gotta see this.
They are the biggest wolves in sheep's clothing of any product out there.
What's healthy and what's hype, from chips to burgers.
Don't be fooled.
And everybody's favorite, cutlets. How good does that look? Yes. Next, Rachel.
Tomorrow morning at 9 on News Channel 5.
Throughout the country, buried pipelines are indicated by a pipeline right-of-way. A long, wide stretch of grass cleared of trees and marked with signs. If you have a right-of-way near your home, do not plant anything in it or dig in it. Do not install a fence or build your kids a super cool fort without first getting the pipeline operator's approval.
Call your local natural gas utility or visit pipesafety.org. Brought to you by the Tennessee Gas Association.
Welcome back to Medical Monday here on The Plus. I'm Casey Mason, joined tonight with Dr. Reddy, and we have some more callers on the phone line tonight. We're going to go ahead and talk to Lauren. Lauren, good evening. Can you hear us?
Yes.
Hi, Lauren. Thanks for calling in tonight. What would you like to talk with us about?
I just had a question. I had surgery on my back about 2 years ago, and my surgeon says there's really nothing else that he can do for me. I was just wondering if there's any other options other than surgery, something a little less invasive that's an option for my back pain.
Sure, Lauren. So anytime someone has back surgery, there's several options that we can use to treat them. We can still try things like epidural steroid injections. We do them slightly differently after you've had back surgery, and we can actually still try that treatment, the radiofrequency ablation, where we disrupt some of the nerves that are causing pain in the joint. It just really depends exactly what they did for the surgery, if they fused you completely or not. But one of the more kind of exciting therapies, it's really not a new therapy, it's been around since the 1960s, is spinal cord stimulation. Spinal cord stimulators were originally fairly similar to pacemakers, and that's kind of what I think of them as pacemakers for the spinal cord instead of the heart. But they use electrical energy to modify or adjust some of the pathways in the spinal cord. So when you think about how the body itself transmits information, it actually uses electrical energy. So these spinal cord stimulators have a battery pack and a couple of electrodes that we insert into the spinal column over the spinal cord itself. So that's within the bones of the spine and right above the spinal cord. And the battery pack is programmed a certain way to send electrical pulses several times a second. And there's two kind of modes of doing it, and some people will feel a little bit of tingling in their back and legs, but some patients feel nothing at all, and it really decreases the amount of pain. And it's not really pain like if you stub your toe that goes away, but it's that always there aching pain that patients have after back surgeries. The really great thing about something like a spinal cord stimulator is it is more invasive than some of the other procedures that we do, in that you're going to have something implanted in you, but it's a minimally invasive surgery, which is one benefit. And the second benefit is really that you get to try it first. So you don't get to try a back surgery per se. Once you have it, you kind of had it, and hopefully it went well. But the spinal cord stimulators, you actually get to do what's called a trial. So we put those electrodes in, and we hook it up to a battery outside of your body. So we kind of tape it onto your back, and you go home with it and you test drive it. So if it helps significantly, which most of the ones that we do for an appropriately selected patient, patients are getting anywhere between 50 to 75% pain relief that we've seen. And they're usually asking me when I pull the leads out the following week, when can I get this device implanted in me? So it's been a really great option, and it's a way to kind of avoid some of the opioid use or minimize it as much as possible. And some patients feel that when they get something like a steroid injection, it helps for, some patients say a few days, some patients say several months, but they want something really long term. And a spinal cord stimulator can often be the answer for that. So it's really exciting.
Yeah, great. Thank you so much for the call, Lauren. We appreciate that. And we also have Bill, I believe, here on line 1. You there, Bill?
I am.
Hi, Bill. Thanks for calling in tonight. What question do you have for us?
I have number 4 vertebrae is off to the left of number 5, and they're talking surgery. Is there anything else I can do besides that?
So it kind of depends what the imaging would look like. So it's generally kind of a forward or backward slippage, and it depends how much it's slipped off, and it also depends how much it's compressing either the nerves that are exiting out or the spinal cord that's kind of protected within those bones. If there's really severe compression of the nerves and you have something like weakness or loss of bowel or bladder control, then oftentimes surgery is really the only option. If the bones are just shifted somewhat and they're still stable and they're not moving off of each other when you bend backwards and forwards, then radiofrequency ablation is something that's a pretty good option for strictly the back pain itself. Radiofrequency ablation doesn't really help your leg pain if you have pain that goes down the legs, but it's probably one of the most effective treatments for back pain itself, more effective than epidural steroid injections typically. Whereas epidurals are really great for if you have inflammation around the nerves that are going into the legs, you can try to reduce some of that inflammation around the nerves. And if you just have arthritis from the shifting of the bones, sometimes we can do an injection into that joint where the two bones are kind of coming together at that L4 and L5 level. It's called a facet injection, so that's an option. But again, it really just depends on your imaging and how severe the symptoms are and how severe the compression of the nerves, if there is any compression of the nerves, is.
All right. Looks like we have another caller here, Sam on line 2. Good evening, Sam. How are you?
Good evening.
Thank you for joining us. So what would you like to discuss tonight?
Thank you. I was just recently diagnosed with arthritis in my back. My question is this something that I would have to deal with long term, or will I be cured with medication?
So it depends, again, how severe it is, but for most patients that have arthritis, to some extent they're going to have to deal with it long term. One of the most simple things that helps a lot of patients even before you get to medication is physical therapy. And it depends how you think about how it affects me long term. Physical therapy is important because what they really do is they give you a home exercise program when you go to physical therapy, and that's something that you do have to commit to doing really every day for the large percentage of the rest of your life. So yeah, you'll be affected in that you'll have to do those exercises maybe 30 minutes a day, 5 out of 7 days a week, but physical therapy alone with maybe a muscle relaxer or maybe some gabapentin for pain that goes down the legs is enough to control a lot of people's pain. So the goal when you come to pain management is not that you'll always be completely pain-free, but to really ensure that your life is as functional as it was before your pain. So we don't want you to always be thinking about, well, I can't do that because my back's going to hurt, or I don't want to do that because my back's going to hurt and I'm going to pay for it later. So we want you to do the things that you enjoyed doing before you had pain, and that's kind of the principal way that we look at, treating pain, is getting you back to doing the things that you want to do and need to do. So you may deal with pain here and there, but I think with physical therapy and some kind of conservative medications, if your arthritis is fairly mild, you may be able to have a really functional life where it doesn't bother you all the time.
All right, great. You know, we appreciate those calls tonight. We really do. I hope we were able to help this evening. It's great that you call in here on our Medical Mondays. It's a really great show to hear free advice and expertise from a doctor. You know, doctor, we heard from both, important to note, both male and female tonight. A question I had for you, are men and women equally affected by back pain, or do you see it more in one gender opposed to the other?
Typically, if you look at the patient population that we have, it seems like women are slightly more affected by it, but in general it's fairly close. And it depends what the cause of the back pain is. When it comes to injury, you know, it's really chance of what happened to who. But when you look at kind of degenerative change, some people have jobs that, you know, they have a lot of wear and tear on their back, so they may be more affected by pain. But I think to answer the question, it's pretty close to 50-50 from what we see.
I was curious about that, you know, kind of situational, and also just kind of talking genetically back pain. What's your advice on that, or just keep an eye on something, for instance, scoliosis?
Yeah. So right now there's no genetic markers that we typically look for or screen for when it comes to chronic pain, but you know, I think in time as pain management evolves, there's probably some genetic component to really all medical ailments these days. I don't know that it's, you know, a gene change that's going to cause you to have back pain, but are you more likely to have arthritis? A lot of times patients say everyone in my family has arthritis, so I think I'm more likely to have it, and they may have it, but at this point there's not specific genetic markers that we look for.
Yeah, you know, we talk about men versus women, but here's another group of folks we may not think of when it comes to back pain or chronic pain. Kids. Really kind of ironic timing here. A lot of folks are sending their kids back to school as we speak, this week and next. What about back pain in children?
Yeah. So we don't treat as many kids at the practice I'm at now, but when I was in fellowship, we did treat children. A few of the things that we typically saw were backpacks that were too heavy, so that's something that should be a consideration. Obesity in children is also becoming a bigger problem these days, so that oftentimes was a big component of educating families on how to prevent back problems from being worse later. But typically kids don't have significant degenerative change in the spine. It's usually muscle spasm, things like that, so it's easier to fix, and kids tend to rebound a little bit better than adults do. So
I'd say so.
Yeah.
And do they still do regular school checks for scoliosis? I remember they did that, you know, regularly as a kid growing up when I went to school. And is that still something they implement?
They do.
That's great. Keep an eye out for that, because I think that early detection it's very important, I would assume.
Yeah, so a lot of times we see patients these days when in a time period where there was no screening, and it gets worse and worse, and you see them when their curvature is pretty severe, whereas now when they're screening kids, they notice the problem much sooner before you have things like really bad chronic pain or respiratory problems. So, you know, screening is definitely a beneficial thing, and you can intervene sooner rather than kind of later in life when there's a little bit more risk to some of the procedures.
Let's kind of dive into more serious side of diagnosis. It's very rare, but serious cases, they can include things like infections and tumors, in some cases kidney stones.
Yeah.
Dive into that subject just a little bit, what you would like folks to know about that as you're detecting it, and just some advice maybe if you do get diagnosed with that.
Yeah, so, you know, everybody thinks, the most common reason we see patients with back pain is typically from the spine, but we do see patients that have kidney stones and things like rheumatoid arthritis, more kind of rare things. So really when it comes down to it, it's keeping a really good recollection of exactly what your pain feels like and what makes it worse and what makes it better, because when you eventually see us, we actually use that information to really kind of correlate your story with what all the diagnoses could be. And if there's more alarming symptoms like weight loss, fevers and chills at night, loss of appetite, trouble with urination, then those are more alarming symptoms that you really want to see your doctor for. And even back pain that's really persistent, you know, that can be something that's more alarming than just kind of the routine arthritis. So if it's something that in your mind is bothering you, it's worth getting checked out rather than just kind of letting it go on and assuming it's just, muscle stress.
Definitely, and you can go to the pain management group to get
Absolutely.
checked out. Well, we're going to go ahead and pause for another break. Keep it right here on The Plus. We'll be right back with more Medical Monday.
There's no single answer to securing your financial future. You need to look at it from every side. Get dependable advice you can count on every week with the Retirement Report on News Channel 5 Plus. Experts on finance, taxes, and the legal system are ready to answer your questions. Don't wait to make a plan for your money. The Retirement Report, Friday mornings at 8 and at these encore times on News Channel 5 Plus.
You worked hard your whole life, paid your taxes, and followed all the rules.
And every week, Social Security took money out of your check.
But when you became disabled, your claim was denied.
You didn't know that more than 70% of initial claims are denied.
And you had no idea how to fight the system to get the disability benefits that are rightfully yours.
Call Hughes & Coleman at 800-800-4600, and we'll fight to get you the Social Security money that you deserve.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner.
Hey, look, it's those guys. Are you good to drive?
I'm fine.
How many did you have?
I should be fine.
You should be?
Go and step out of the vehicle for me.
See ya, buddy. Good luck.
So turns out, buzz driving and drunk driving, they're the same thing, and it costs around $10,000. So not worth it.
Good evening, everyone. Happy Monday to you. You are watching Medical Mondays right here on News Channel 5 Plus. And tonight we are so happy to have Dr. Reddy here with us with the Pain Management Group. Doctor, we've learned a lot tonight.
Great.
I think you've answered some great questions for folks and given that free medical advice. It doesn't get better than that. It's absolutely free. So
absolutely.
Well, we really appreciate your time this evening. And as we kind of come to an end here at the show, we have a few more, a little more time left with you. But we talked a lot about the back. We talked a lot about the back. So we're going to kind of move to other parts of the body that also, of course, we have chronic pain issues with.
Absolutely. So after the spine, probably the most common thing that we see is knee pain. So what can we do with knee pain? Again, it starts with imaging and things like physical therapy, but some of the interventional techniques become a little bit different in that we're not doing epidural steroid injections, but we do steroid injections in the knee joint itself. That's something that we just do in office, so it's fairly simple. And then there's something called viscosupplementation, so that's kind of putting a gel cushion into the joint again. And then lastly, if those two techniques don't help, and you've seen a surgeon or you're not a candidate for surgery at this time, then there's something very similar to what we do in the back with the radiofrequency ablation, but it's a different set of nerves. So the nerves that innervate the joint capsule itself, we can also go in and do an ablation on. So it's called a genicular nerve ablation. So a lot of options for the knee as well.
Yeah, it's great to hear. We have talked a lot about options tonight that are non-surgical. That's really, it seems to be the last resort. That's
absolutely. So I think most surgeons these days, especially for the spine, would say that surgery itself is, kind of the last option when there's no other treatments that are helping or beneficial. And a lot of surgeons even these days would say that something like a spinal cord stimulator comes even before back surgery rather than after back surgery, because you don't get to try a back surgery before you have it, whereas you do get to try a spinal cord stimulator. So unless you have alarming symptoms like weakness and, again, bowel and bladder incontinence or loss of control, then a lot of times you can avoid surgery with some of the less invasive techniques.
And I feel like a lot of folks, they do, experience that pain. Their first reaction is, oh, I'm going to have to set an appointment. I just know I need surgery. Is that a misconception? And what are some other misconceptions as a doctor that you'd love to, as we have you here tonight, just kind of clear the air?
So yeah, one of the major misconceptions is that you will go and just kind of have surgery, or that if you're getting sent to pain management, that the only thing you're getting sent for is to just get pain medications. But it's really for assessment of your pain and to see what all the options are. It kind of depends how you get into our clinic. A lot of times if you've already seen the surgeon, they'll send you back to us to say you're not quite ready for surgery, let's try some of these less invasive techniques. But a lot of times we get patients straight from primary care doctors once they've had a little bit of imaging to show that they have some degeneration in the spine. So we really get to work them up from square one and make sure that they don't have any alarming symptoms, and then try all the kind of stepwise treatment. And for most patients, you really do get to avoid having back surgery, but we have a few that eventually then we would refer you to a surgeon. So we kind of fit between a primary care doctor and seeing a surgeon and trying some of those less invasive techniques. So you don't always have to have surgery. You don't always have to have injections in your spine, which is another misconception. If conservative treatment like physical therapy and a few simple medications treat pain, that's great. We're happy to do that too.
You're in that nice, happy medium place where we like to live. So
absolutely.
There are a lot of options that, are non-invasive and non-surgical. And kind of speaking of that delicate care, there's also another group of folks I'd like to address tonight, and that's pregnancy. Dealing with, pregnant woman comes in and, you're kind of dealing with different options. How do you go about treating someone?
So one of the major things that you really have to be careful with during pregnancy is that you want to be careful with the types of medications that you're using. So almost all medications that are used for pain management typically have some kind of risk to mother and baby during pregnancy. So that's a really important discussion that we like to have with patients, is discussing what the medication options are. You also have to be a little bit more creative when it comes to imaging, and going with imaging that you've had before pregnancy, because you can't expose the mom to radiation. So that's another kind of complicating factor. So generally when it comes to pregnancy and any kind of back pain, you try to be as conservative as possible, and really you don't want to do even most of the procedures we're going to do expose you to some form of radiation. So we don't do any of that kind of stuff during pregnancy. So physical therapy is tolerated, and then finding things kind of that are non-invasive at all to try to relieve your pain. Things like massages, those are always nice.
It does, it does pose a challenge. That's definitely, for sure. When you are pregnant, how do you know whether it's just your common pregnancy back pain or when it's time to actually seek help?
So I would say that if you're having symptoms to the point where you can't sleep, or it's really kind of an acute change in your pain, meaning that you've had pain, and then all of a sudden you have a very different type of pain. If you have symptoms that are now going down a leg, like numbness, tingling, weakness, where your leg's giving out, if you have any change in bowel or bladder patterns, and again, that kind of stuff can also change during pregnancy because there's a lot of different body parts that are affected by having a baby within you. So really, the things that are concerning are big changes in the type of pain that you're having, and pain to the point that you're completely non-functional. You're not able to do any of the things that you need to do during the day, or any of those neurological changes that we discussed.
That's really great advice. I think that's very interesting for folks to know, because you always want to keep an eye on the situation, but you don't want to make a call if it's not necessary, but you also don't want to put yourself or your baby at any sort of risk.
Absolutely.
Another topic too along those lines of kind of knowing when is the right time to call in. Folks that really, they pick a certain occupation that poses more of a challenge, a more physical occupation where you are doing physical labor. And how do you approach someone with the advice of a doctor? How do they have to get the job done, but they also need to take care of themselves. So how do you handle that dilemma?
So, there's a lot of different occupational hazards. So, beyond just kind of hard labor and things like that, when it comes to hard labor, you want to be really safe at work and not overdo it or strain your back too much. If you can't do it, sometimes it's not something that's for you. So, you don't want to overdo it and cause problems like an acute disc bulge that's going to compress your nerves that you may have to, have treatment for. So taking it easy, resting at night, using heat, ice, things like that, using anti-inflammatories. If that kind of stuff treats your pain, you're probably not overdoing it. But if all of that does nothing to your pain, you may be overdoing it. One of the other kind of overlooked things is positioning. A lot of us work at desks all day. So positioning when you work at a computer and you're typing is really important for your neck. So making sure that you're working at eye level and you're not looking up or down all day, and that we all set up a little bit
I'm working on my posture here while you're talking about that.
So that's something that's commonly overlooked. But if you think about it, 25 years of looking up and down is going to cause some wear and tear on your neck. So that's something that you really want to be mindful of.
Kind of coming full circle here, we discussed this at the very beginning of tonight's show, and that was talking about really something very special that you all offer at the Pain Management Group, and that is therapy and kind of mentally getting healthy. Because I will say, when you are displaced from something like back pain, for instance, you can't work, you were a construction worker, a firefighter, and it puts you out, it's not only physically painful, it can be mentally disturbing as well to deal with something like that, especially for a long period of time. Kind of go back and to reiterate why you all offer that and why it's so very important.
Absolutely. So, when I think about it, I see a lot of patients every day, and, fundamentally changing what you can do every single day and limiting yourself because of your pain is bound to cause anxiety and depression. I mean, it's rare that we have a patient that has had years and years of pain that isn't affected by depression and anxiety somewhat. So we really felt like it was important to address that component of it and not just say we're going to focus on the pain and treat the pain. But I think if you don't talk about the depression and anxiety that goes along with having chronic pain, you're really never going to be successful at truly treating the pain and the whole experience of a patient's day. So that is something that's really important to us. And again, some of it is also biological in that, when patients have a traumatic experience that causes pain, some of that imprints in the same area of the brain that, pain also lives in. So, there's a biological component to why people have depression and anxiety with their pain, but there's also the kind of day-to-day component of it, which is unavoidable. And we just want to acknowledge that and make sure that we're taking care of that component as well.
Taking care of all aspects of your health. And real quick, if we have a second here left, we do have one more caller I want to get to before we get to running out of time. Good evening. Can you hear us?
Yes.
Hi there. Real quick, what can we help you with this evening?
I just had a question for the doctor, hoping he can help me. I have been having some pain down my leg, and it seems to have occurred 6 months after I had an ACL reconstruction. Any thoughts on that?
All right, about 30 seconds.
So it depends, but one of the things you want to consider if you've had an ACL construction is how you were positioned during the surgery. So was one of your nerves entrapped or compressed? And also, was there a direct injury during the surgery? So, nerves go in a certain pattern, but they're not always predictable. So you want to make sure that you're not having any pain from a nerve injury, either from the surgery itself or from positioning for the surgery, which are, positioning injuries are not as uncommon as you'd think.
All right, appreciate you squeezing that in there. We wanted to get that last call in. We'll be right back after this quick break.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
It's been a soggy and therefore cooler start to the week than what we had last week. Rain helping to suppress temperatures a touch this afternoon. And we've had some very efficient downpours in some spots overnight Sunday into Monday. Some folks have seen nearly 1.5 inches, even a little more. Now, as we head into Tuesday, Wednesday, it will be a drier stretch, but not completely bone dry. We can't kick those rain chances just yet. Here's a look at temperatures across the southeast. We are not the only ones on the cooler side of things. Normal for Nashville this time of year is 90, and we're not expecting a 90-degree temperature anywhere this week. Here's a look at current conditions in Nashville. Overnight tonight will be fairly mild, and then we'll continue to see rain chances. Stubborn rain chances stick around. So a spot shower storm is possible during the evening. That'll be the same thing for Tuesday and Wednesday, with more widespread rain expected as we head towards Thursday, Friday, and Saturday.
Tuesday on Talk of the Town, we're bringing out your inner artist.
See where to find classes and workshops for all ages, from toddlers to adults, teaching the confidence to create.
Your apple pie recipe could win you $500, and bragging rights is the best apple pie in Tennessee.
Find out how to enter and get a recipe that's a real winner.
Plus, the do's and don'ts of communicating in today's tech-savvy world.
Expert advice for when a text or email is okay and when a handwritten note is a must. Tuesday at 11 on Talk of the Town.
Your son wants to get a cat, but you're allergic. Do you A, prepare yourself, B, make the best of it,
C squared equals 25.
Good job!
or C, find a loophole? When it comes to parenting, there are no perfect answers, but that's okay, because you don't have to be perfect to be a perfect parent. Teens in foster care will love you just the same.
Well, thank you all so much for joining us here for another Medical Monday on News Channel 5 Plus. We really learned a lot tonight about back pain and chronic pain. Dr. Reddy, thank you so much for joining us.
Yeah, thank you so much for having me, and for everyone for calling in. It's been a lot of fun.
You know, we do want to go ahead and give out some information here about the Pain Management Group. You can go ahead and check them out, and their number that you can call if you'd like to reach out is 615-941-8538. Again, Dr. Reddy, thanks for joining us tonight, and we will see you again on our Medical Monday here on News Channel 5 Plus. Have a great week.